in the broadcast?
Okay, we're just starting it now, Chairman.
Will you let me know when it's up and running?
We're live, Chairman.
Thank you. Okay, welcome everybody to the Cabinet meeting for Hampshire County Council, today the 24th of November. First of all, are there any apologies for absence? I haven't got any. I can see virtually all of you there. Does anyone know anyone that's not coming? Okay, we have no apologies. Declarations of interests. This is the normal declaration. Anyone that has a disposable pecuniary interest in any matter to be considered at the meeting must declare that interest under the members' code of conduct. Leave the meeting while the matter is being discussed, save for exercising any right to speak in accordance with the code. Furthermore, all members with a personal interest in a matter being considered at the meeting should consider, having regard to the code, whether such interest should be declared having regard to part 5, paragraph 5 of the code. Consider whether it's appropriate to leave the meeting while the matter is being discussed, save for exercising any right to speak in accordance with the code. Okay, moving on to item 3, minutes of the previous meeting. These have been published. Are you all happy for me to sign these as an accurate indication of the previous meeting? If you're happy, don't do anything. If you've got anything to say about the meeting, or if you're not happy for me to sign them, please put up your hand now. Thank you all very much. I will sign those minutes. We have no deputations. And moving straight on to my opening remarks, my chairman's announcements. I have no direct announcements, but I think I ought to point out that we are obviously, with the pandemic, moving in a very rapid way at the moment. And indeed, some at least of the items that come up at agenda items 6 and 7 have already been overtaken by events. And I'm sure that we'll be brought up to date with any changes to those 2 items when we discuss them. In general terms, we now know that we're moving out of the present lockdown next week after the 2nd. We also have an indication that the tiers will remain tier 1, tier 2 and tier 3 that we'll move into, but those tiers will not be quite the same as the previous ones. And I think I would just repeat what I said at the beginning of this period of lockdown. It's important that we abide by the rules very strictly now, so that we have the best chance of coming out at a relatively low tier after the 2nd of December. We also got indications of the relaxation that is going to take place during the Christmas period, and we'll get more information about that in the coming days. And of course, the better news is that we now have potentially 3 vaccines to deal with the virus. They still have to be properly licensed by the appropriate authorities and regulatory bodies, but there is the hope that at least some individuals in high-risk areas will be inoculated, vaccinated by the end of this year. We will be producing a list of priorities as to which individuals have the vaccine earlier rather than later, depending upon age, physical, whether they're suffering from any specific type of illness, and whether they're in a particular occupation. But more information will come out in the coming days and weeks on that. But we can expect, as was indicated in the press conference yesterday, the national press conference, that we will continue in some form of restrictions throughout the rest of this winter, and the extent to which we come out finally in the spring will be partly dependent upon the way we abide by the rules in the intervening period, and partly the result of how rapidly the vaccinations can take place across the country. These are going to be a huge logistical exercise, bearing in mind that all the vaccines that have been published already, the 3 of them, require at least 2 injections, or require 2 injections at a certain length of time between, with a length of time between the 2 of them. That's all I've got specifically on the pandemic, but I think I'd just like to add a couple of general points about Hampshire. I'm very encouraged indeed by the way everybody in both the public and the private sector has worked together in our county. I am meeting up with our districts tomorrow and the unitaries, and the fact that we share information on a regular basis, we try to work together, as I say, as closely as possible, I believe has had a direct effect on the way we managed to dampen down the worst effects of the virus. We have a very high level of attendance at our schools. Relatively speaking, our rate of positive of positive tests, in other words, the number of people that have been identified as having the virus, has remained throughout the period of the virus below the national average, and indeed in many cases in our county well below it. And all we've got to do is keep at it for the next few months to ensure that we get out of this particular phase as quickly as possible. And the final point I'd make is, obviously, I'm very conscious of a number of businesses that have been very badly affected by the pandemic, and we need to do everything we can to ensure that we get back to some form of normality quickly, ensuring those businesses get up to a level of activity where they're profitable. And we acknowledge the fact that as a result of the virus, there are specific problems in specific areas, and the obvious one that comes to mind at this particular period is the ability, or the lack of it, which hopefully will change, of relatives being able to see their loved ones in care homes and nursing homes, and indeed in hospitals. And on that point, I will move on now to the next agenda item. Agenda item 6, progress report, the County Council's response to COVID-19. And can I ask the Chief Executive to lead on this particular item?
Thank you very much indeed, Chairman, and good morning, Cabinet. In some respects, I'll be elaborating slightly on what you've just gone through, Leader, so thank you very much indeed for that. So this is a report which has now become a regular item at the Cabinet, considering our progress and our management of the crisis as a County Council and on behalf of the community of Hampshire. As such, it's a regular report. We have tried to edit the report slightly for this version so that we don't get stuck into too much of a rut with the writing of the report. But I have also been advised that the report is regarded as a helpful audit trail in terms of our management of the crisis, bearing in mind that we are now still in an emergency planning mode rather. So I feel the report is still fairly full, but necessarily so, and it touches upon, Leader, a number of the points that you have just made. We have, though, tried to make sure that the content of the report, particularly around services, is a little bit more by exception rather than too much recording of the obvious. I will in a moment invite Simon Bryant, the Director of Public Health, to talk Cabinet through the references within the report to the state of the pandemic within the county, both in terms of current data, but also in terms of that highly dynamic picture which, Leader, you've just referred to, particularly with regard to announcements this week concerning the lifting of lockdown next week and what the potential implications may be for the county of that. It is a moving picture, it is a dynamic situation, and one that we're trying to make sure that the county is as responsive to as possible. And when Simon has done his update, I will go through some of the services and response issues as well. And then obviously between the two of us, we'd be very, very happy to take questions. So without further ado, if I may, I'll invite Simon Bryant, the Director of Public Health, to make reference to the pandemic related dimensions of the report. Thank you, Leader.
Okay.
Good morning. Is it all right, Leader, if I take this forward from here?
Yes.
So with regard to the latest position in terms of the pandemic, we're looking at the 7-day figures because that gives us the best indication of how the pandemic is spreading. And within Hampshire, our 7-day rate is 140.6. In the last 7 days, we've had 1,944 cases. That compares to the southeast of England at a rate of 177.4 and England at 240.7. So what we're seeing is that we are below the southeast and the England rate. And if you look across the country, you see that the north of England has been had more cases and worse impacted by the pandemic. We're seeing the northeast, northwest and Yorkshire and Humber areas further impacted. What we have also seen is variation across our districts with fluctuation of 7-day rates at different parts of the county, showing kind of rates going up and down. And that's partly due to the way the infection is spreading in our communities and amongst us, but also due to the smaller geography, meaning there's a fluctuation of data, kind of statistical variation. Just really important to bear that in mind. Another key factor that we think about is that rate in over 60s, because we know that the over 60s are more likely to be impacted by the pandemic in terms of the impact on their lives and the way that they are affected and needing hospitalisation. So our 7-day rate there is just around 120 per 100,000, again below the southeast and other areas, but that does again vary, and we've seen particularly in Portsmouth rates being higher across the whole population, so a very close neighbour there. It's worth just highlighting the impact of the lockdown. We knew it would take a few weeks to bed in and show an impact, and that's due to the fact that we know that the virus has a 14-day incubation period, so it takes about 2 weeks for that to come through. We've started to see some very green shoots of optimism there that the rates seem to be slowing down and perhaps plateauing. However, we've only seen that for a few days, less than 3, I think. So as that goes forward, we'll continue to monitor that, but actually that's beginning to show some good news. But however, our overall trend is an upward rate because we haven't seen that for long enough to know that that's coming down. With regards to hospitalisations and people impacted by COVID having to go to hospital, we've seen that the southeast has been fared better than other parts of the country again in terms of hospitalisations and people requiring mechanical ventilation with the rates lower, and currently we have about 38 people in hospital beds for COVID-related illnesses. And finally, with regards to deaths, we do look at deaths in the last week of recording, so that's week 45 of the year. We've had 14 deaths from COVID, and that's going up again, and we knew that as we get more cases, we do get more deaths. So just moving on quickly, we've also seen the vaccination news, as you've highlighted, Leader, coming out really positively. So we are working with the NHS to ensure an effective rollout of that when it's ready and when it's signed off by all, as you said, the safety mechanisms, and looking at how we ensure that the population of Hampshire gets vaccinated effectively. Finally, very topical, is the news announced from the government yesterday. We had some more information about the tiers. So we were in a tiered approach to managing this pandemic at a smaller geography in the country prior to the national lockdown. There will be 3 tiers again. They're going to be tougher than before, as they're more stringent, so that actually we know they can be hugely beneficial. Previously we knew some of the tiers were not as effective as perhaps they needed to be. So we are thinking about the measures and being advised by government what measures are going to be in place for different tiers, thinking about our retail and our hospitality, our outdoor sports and other things. My understanding is that schools will remain open throughout all levels of tiers, as they are through the national lockdown. So we'd expect those to remain open, and that's really good news for our children and families. Leader, I'll pause there. Happy to take any questions now or at the end of the Chief Executive's presentation.
Thank you very much, Simon. Judith.
Thank you. I do have a few words I'd like to say later on, but just could I ask Simon with regard to paragraph 19 and draw everyone's attention to that. Whilst our figures and rates of infection are comparatively low, it's the increase that's been slightly worrying of the rate. Back on the 9th of October, the Hampshire rate was 28. And then 131.1 by the 13th of November, and then we hear it's a little higher today. So I just want to draw everybody's attention to that, because it's the direction of travel that's important as much as the numbers, or probably more so than the numbers. Every time I see these numbers go up, I think of that the Disney film The Sorcerer's Apprentice, when the broom keeps getting chopped in half and gets out of control, and we really don't want to get to that stage. Thank you.
Yes, thanks, Councillor Gillespie. I absolutely agree that as I said, we've seen an upward trend. We're beginning to see those kind of green shoots that actually that's slowing down with the national lockdown. And you're right, we need to keep onto that and make sure that we carry on the really good work of the Hampshire population and our colleagues within the council and partners have done to manage that, and how we keep that going during the next phase of this restrictions that we're seeing through the tiered approach, and take a really strong approach to that.
Councillor Reid. Microphone.
Second time I've done that. Thank you, Leader. Simon, you mentioned that we're working with the NHS in terms of planning for the rollout of the vaccine. And I think that most people will now be looking forward to getting vaccinated and seeing it as an end to the immediate crisis. Now, my understanding is that the responsibility for the vaccination is going to be in the hands of the primary care trust, so the GP surgeries, which means that it could be variable. Do we have a role in trying to get consistency of rollout and making sure that every area is getting the same quality service as every other area?
Yes, thank you, Councillor Reid. So the vaccination programme has been overseen by the CCG, and one of the primary routes is through the primary, as you say, primary care, and then working in what their primary care networks. So each primary care network will have a way of delivering that. They're very effective at delivering flu vaccination on an annual basis. So actually that's the right way for most of the vaccinations to be delivered. Alongside that, there will be a community approach with settings in the community for people to get vaccinated. We haven't got the details of whether that's going to be an invite program or a kind of a drop-in program, but as the leader said at the beginning, there is categories of people. I think there's 11 categories, and so they'll start at the top and the most high risk and come right down those areas, so that we vaccinate people in the right time. So it will start with care home staff and the NHS staff and the over 85s, and then work down as Councillor Manns identified, maybe those with long-term conditions and the younger population. We are working very closely with the NHS to ensure that the programme is very well embedded and that those vulnerable populations get the vaccination, as you say, that people want and need to move forward. And we'll see a huge rollout of this in the new year.
Thank you.
Any other questions for Simon? Any other questions at all on this item?
If I may, Leader, Councillor Fairhurst is showing a hand.
Oh, sorry. Yeah,
and I do still need to go through. I would like still to go through the rest of the report in due course, if that's okay.
Yeah.
Do you want to go through? Well, I was going to say, does John want to carry on, and I'll come in at the end? Yeah.
Very happy to do that at the leader's discretion. Is that okay?
Yes, that's fine.
Okay, I'll work at pace, if that's okay, members, just to make sure that we've covered off some of these issues around the organisation itself. The one point I would add to Simon's briefing about this, the management of the pandemic at a local level, is just to refer members to the references within the report to the work of the local outbreak engagement board and the health protection board that sits alongside it. This is proving to be an important dimension to our engagement with the community and with partners, with the leader chairing it. We make reference, and if I may run through some brief service issues, with regards to adults' health and care, extraordinary continuous work going on, particularly within the care sector, but not just for older people. We have to remember that adults' health and care work with a range of vulnerable groups who are also being supported in a range of different ways. Leader, you mentioned earlier the issue to do with visiting to care homes, and since this report went to press, we were successful in establishing ourselves as one of the pilot authorities to support testing to encouraging visitors to care homes. That work is going forward at pace with a small number of our own homes and independent homes, and will help us move forward nationally in terms of opening homes up to visitors in a safe and effective way. And I'd also refer to paragraph 35 about the exceptional work that's been done at pace in partnership with the NHS to ensure that we've got adequate what are called discharge to assess beds, to make sure that patients can leave hospital swiftly and be assessed outside of hospital for where they're to go to next. And that's made a huge difference to our NHS partners, particularly in the acute sector. On children's services, we do need to note the continuing additional stress on the social care side, which is a post early lockdown, first lockdown, and the increase in referrals that our staff are dealing with. They're managing that pressure, but the pressure is real and feels now to be continuous. Leader, you've referred to the exceptional work that's gone on within the schools community in Hampshire, I believe supported by a robust local education authority. The levels of school attendance in the county are exceptionally good and are very, very well supported by the local authority and our partnership with the families of schools of all types, and that's to the credit of all and is helping enormously to the welfare of children. Within ETE, there are some standard issues that are reported within the report there, but I just would add for members the very positive news that's referred to in paragraph 45, that the bids that we made for additional transport schemes were almost entirely successful. So we now have a substantial pot of money to work with to take some of the work forward around transport amendments that are going forward during the period of the pandemic and potentially beyond then as well. Within CCBS, that's obviously the department that covers a range of different services, all of which are adapting and amending to the challenges of lockdown, particularly in our country parks and our libraries. And also CCBS is the host department for the County Coroner's Service. Huge pressures there, but being very well managed in my view. The section on resources, Leader, also makes reference to some of the conversations that have happened politically in recent months about issues to do with access to services, including around telephony, and tries to give members a clearer perspective of the much more complex and varied requirements and responsibilities that the County Council is managing in terms of its public access, and I hope gives strong reassurance that the technical work that's being done to make sure that we are open and we are accessible to all service users across the range of services that we manage. Penultimately, for this, Leader, if I may, as briefly as I can, there's a section on the County Council's staff, on the people of the organisation. I would like to take the opportunity as head of the paid service to again pay respect and thanks from all of us for the work of our staff during this period. It has been extraordinary and continuous. Staff are tired, but I do think that the references to the vaccine and the potential to things to change in the spring will help people work forward, but they're working extraordinarily hard and extraordinarily well, including with regard to working from home wherever possible, and that being adopted very well within the organisation, including with exceptional IT support. We are surveying the staff, we are staying in touch with them, we are listening very, very carefully to their experiences, and we'll be taking on those experiences as we start a piece of work now organisationally to think through in deep terms what the post-pandemic working life will be for our organisation, which will be a major piece of work we'll bring back to Cabinet in due course. Finally, on communications, we make reference to the good communications work that's going forward. And I'd finally add that I think that communications work will be particularly significant for the way in which we promote take-up of the vaccine in due course. That's all, Leader. Thank you very much. Very happy to take questions, as would Simon. Thank you.
Thank you very much, Chief Executive. Councillor Fairhurst.
Thank you, Councillor Mans. I'd just like to draw members' attention to paragraph 16. Now, John has already alluded to the fact that we have discharged to assess beds, but we also have 3 designated sites which take COVID-19 patients out of hospital. Now, this greatly assists our colleagues in the NHS, but also it helps us in remaining in possibly the lowest possible tier, as hospital admissions and the state of the hospitals is one of the things the government looks at when deciding which tier to place us into. So hopefully it not only benefits the patients coming out into our care, but also it will help us remain in the lowest tier. Thank you.
Thank you, Liz. A very good point that we're benefiting the NHS by doing this. Excellent. Councillor Gajewski.
Thank you, Leader. Are you just doing questions at the moment, or is now the time for me just to say a few words, please?
No, you can say a few words.
Well, I wasn't sure if you wanted that later. Thank you.
No.
Well, you know, I make no apology for how I'm going to start, because I've said it before, but I'm going to say it again. I want to thank Simon Bryant, our Director of Public Health, the Public Health Department staff, and staff across the council, including Mr. Coughlin, who can't thank himself in public, for what they've done and continue to do in responding to the pandemic. I mean, in the summer, we clapped for carers, and I think that it's a pity we're not meeting in person, because I think the whole lot of them deserve a round of applause. In public health, they've had to work across all departments to support the response to COVID-19, children's services, adult social care, culture, community services, and beyond the council, working with districts and the NHS and our other partners. And I have to say that our communications teams have really excelled themselves in getting the message out. You know, every piece of advice is getting out there via a whole range of media. And the last monthly report that I presented to the local outbreak engagement board showed that just with social media posts, we were reaching almost 1 million people. I mean, that is just a fantastic achievement, because it is important that everybody gets the message. We've had positive news about vaccines this week, and but yeah, that's not now, that's for the future, hopefully near future rather than long-term future, but we are still in lockdown, and you know, we all understand how tough it is for people in lockdown, but you know, government can only make rules don't work if people don't follow them. And I'd like to come back to paragraph 17 of the report, and also something that you mentioned or alluded to in your opening remarks, Leader. The better that communities and organisations can implement the lockdown, and we do still have 7 days to go, the better the chances of the second wave being halted and us being in a lower tier as we move into the next phase. I've already talked about the rate of increase, which is worrying, but you know, I'd go so far as to say that we all have a duty of care to each other in this, because every death from COVID is one too many. So while local restrictions will continue, local track and trace, the utilisation of rapid testing have the potential to really help us get an even firmer grip on the spread of the virus. And I know that the Public Health Department and our partners are ready to make this work while we await the vaccination programme. Thank you, Leader.
Thank you, Judith. Andrew. Councillor Joy.
Thank you very much, Chairman. I think the points have been very emphatically made over the need, the absolute necessity for sort of public discipline here. But it's a message that's obviously got to continue to be made, because we can't afford to relax for 1 minute. But at the same time, I also would like to add my thanks for the very evident commitment right across the council, particularly, of course, from public health, where the example and leadership of the director Simon Bryant has been outstanding. And I've been particularly felt locally supported with information coming out on the education side in monitoring the schools, because quite clearly from time to time our local schools are having cases and numbers of pupils being sent home to self-isolate. And if we don't actually monitor those, and we have been monitoring those very closely, then one might have the impression that, in fact, schools are gradually emptying, whereas, in fact, as the Chief Executive has pointed out, the complete opposite is the case, and that is that school attendance is exceptionally high and being maintained across the county, notwithstanding the fact that from time to time groups of pupils are being sent home to self-isolate because of certain occurrences. But I've got one question seeking a bit of clarity, and I suspect that Simon Bryant is the ideal person to answer this. In paragraph 20, where we've got these graphs which show in particular the deaths in a particular week with a proportion where COVID-19 is mentioned, I think we would all agree that our responses and our measurement of where people should be in tiers and so on, and our ability to assess the progress that is being made depends on accuracy of data. So when it comes to, for example, the deaths chart there, and it distinguishes between where COVID-19 is mentioned on a death certificate and it's not mentioned, could we make it absolutely clear that those death certificates where COVID-19 is mentioned are on those where there has been a positive on a COVID test? Because there are times when there is no positive test, but there's still a mention of COVID-19 on the certificate. Now, can we just clarify exactly what that means?
Councillor Joy, leader, shall I respond to that?
Please do.
Thank you very much, Councillor Joy. You're absolutely right. So when it's mentioned on the death certificate, that means it's one of the underlying causes of the death. So actually the doctor will be certain that COVID has had an impact on the death. Now, that should be confirmed by a test. However, you know that when you look at medical tests, sometimes actually you do a diagnosis through kind of observation and symptoms and all those kind of things. So it's not just simply a test, because actually there are many things. But so I can't assure you that 100% have had a COVID test, but I can assure you 100% have COVID symptoms and have COVID disease. But some of those will be by doctor's discussion, and but the majority will be by COVID test, because that's how we're doing it.
Thank you.
Thank you, Simon. Are there any other questions or comments? Councillor Reid?
Yes, it's just, I think, a comment, and the officers might wish to respond. But as we enter the phase where the vaccine starts to roll out, there's going to be some positivity about it, but there will also be some negativity, either people misinformed or just anti the idea of the vaccines. And I think we have a duty as a local authority to spread the truth about the vaccine programme and encourage people to take it up where that is appropriate. Are we giving any thought to either Chief Executive or Simon as to how we may use our role positively to spread the truth and encourage the vaccine programme to be successful?
John, perhaps you'd like to respond to that.
If I may, yes, please, Chairman. I think this is a really important question, and one that we are giving very careful consideration to immediately. There are at least two dimensions to this, and the Director of Public Health has explained that we're in the process now of working with the NHS in support to them. They have the lead around the delivery of the vaccination programme. But we're obviously the County Council, we have a major community leadership dimension, and we also, if you include school staff, are responsible for over 30,000 employees within the community. We're aware that there are concerns, and there is a science around understanding the concerns about vaccination, some of which is to do with legitimate concerns, some of which sadly is to do with the way in which, for example, social media may play upon people's fears. But we are very clear that we've got a communication responsibility to our staff as individuals, but also through our staff as, if you like, ambassadors within the community, and to the community, to promote the take-up of the vaccine as quickly and as comprehensively as possible within the tiers of take-up that the NHS will be deciding. Because undoubtedly, the quicker, the more comprehensive the take-up of the vaccine, and the outstanding work that's being done across the country to promote, to establish a vaccine, then the quicker we get out of this pandemic with all of its dreadful effects upon our services and upon the economy. So absolutely, we see this as a vital role, and Deborah Harkin, in charge of our communication services and systems, is working now on the way in which we approach this tactically and strategically, bearing in mind that we do understand it's much more complicated than simply regaling the community to say take it up. We have to think through why people are nervous, if they are nervous, and how we encourage them. But it's a key role for the future for the County Council, in my view, Chairman.
Thank you, John. Absolutely right. Any other questions? Are you all therefore happy with the recommendations of Para 1, little 1, 2, 3, 4 and 5? If you're happy, if you approve them, you don't have to do anything. If you don't like them or you want to comment further on them, please put your hand up. Okay, I can see no hands up, so those recommendations are approved. Before we move on to the next item, I'd just like to add my own thanks on behalf of all the Cabinet, my thanks to all your staff, John, for all the work they've done, all the work they're doing, and no doubt the work they're going to be doing in the future as well. And to pass on to those people they work with, such as the NHS, other local authorities. We're very conscious that by working together, we have a better chance than most of actually bringing this particular pandemic to an end. So please pass on our thanks to all your staff.
I will do that. It's much appreciated. Thank you, Chairman.
Thank you. And moving on now to item 7. And before we actually start debating it, Councillor House, I understand you'd like to say a few words about item 7, the financial update.
Yes, thank you very much, Chairman. And I made the point of not coming in on the previous item and taking up more of Cabinet's time on that, but to echo and endorse your comments at the end of that item in terms of support across the Council and to our partner organisations. I've, as you know, obviously had the opportunity of being involved on a regular, several times a week basis, it seems at the moment, engagement in the local outbreak engagement board, which I found to be really helpful and positive. And thanks again to Simon and all the team, and Judith for that matter too, for all the work that's gone into that. It's the COVID issues in the financial report that I just wanted to touch on very briefly, and mainly to ask a question at this stage. I'll make wider comments on the financial issues at County Council next week. There's clearly a lot of detail in the paper on a range of issues. I thank Karen and the team for that, as always. The question is about how we deal with the remaining unfunded net cost of COVID for the long term, which is clearly a substantial sum. The paper gives a variety of different figures, mainly for the current financial year. It doesn't appear to give an expected long-term figure, and it may be too early to come up with that at the moment because we don't know what the ongoing costs into 21-22 will be for COVID. But we haven't yet got any clarity of how we are going to pick up the long-term unfunded costs of COVID. It's pretty clear that the government isn't going to meet the bill, despite the exhortations we were given by Rishi Sunak and by Robert Jenrick at the start of the process, which is deeply disappointing. And I know that every council in the country is in this position. But the numbers for Hampshire are, of course, of a scale which is unlike anything which most councils in the country will have to cope with, simply because of the scale of Hampshire. And the figures of something like 40 or 50 million pounds this year, who knows what that takes us to for 21-22. Various ideas have been touted. in terms of how to deal with that unfunded cost, including rolling it up and funding it over the long term as a one-off, effectively like a one-off capital cost. And I just wondered if Carolyn could give us any advice this morning on that issue. You're muted, Chairman.
Thank you, Keith. Right. Okay. Right. We'll move straight on now to the report itself, and I'm certain that the Treasurer will be able to comment on what Councillor House has said during her response. Carolyn, would you like to take us through this particular report?
Chairman, thank you very much. And yes, hopefully, Councillor House, as I quickly take you through the report, I hope I will be answering your question, but if not, please come back at the end. So the report, as you say, is comprehensive. It covers the impact of COVID. It covers an update on business as usual. It updates our new baseline position for transformation, and it also looks to the impact on the medium-term finances of the Council. I'll lead you through just a couple of the pages. If you look at the top of page 51, this table presents for you the gross losses for the current financial year as a result of COVID. And you can see that that's some 177 million. Turning to the next page, this then brings in the various grants and income reimbursement, etc., that we've been able to allocate against that gross cost to give us the net unfunded costs and losses for the current financial year, which stands at just under 40 million. If you look then at page 54, this continues the information into the impact of COVID on the County Council in the medium term, so taking us through to 2023-24, and you can see the estimated total is some £210 million. You'll recall in previous reports we talked about a support package that we could draw together by identifying all and every reserves that we could reprioritise from current purposes, basically that are not legally committed, in order to give us the firepower to meet that £210 million. Whilst we did maximise the reserve reprioritisation, and we have a support package of a maximum of 160 million that we can bring to bear, even if we were to use that 160 million, that still leaves us with a gap of 50 million. And therefore, the crux of the matter is, if government do not provide at least another £50 million, then we will not be financially viable in the medium term. And even if they do provide, let's say, the 50 million and we use our maximum 160 million from our reserves, that will leave us, because of the impact on reserves, extremely vulnerable to any future shocks. In terms of just a brief update, I can confirm that our claim for sales fees and charges support has been approved, and we received £2.5 million this week. Unfortunately, it's not fully funding the impact. We are allowed to claim 75% of 95% of that impact. And we are also still waiting for an update on council tax and business rate support. So far, we have heard indication that we can spread the costs of those aspects over a 3-year period. Spreading the cost doesn't really solve the problem. The problem is we're expecting that we need new cash to make up that loss of income within our financial position, and therefore we're waiting to see what else government will tell us on that. If I take you then to page 56, as you know, we did a new baselining exercise for our transformation programmes, the final aspects of the T19 programme and the ongoing T21 programme. And basically, if you look at the yellow line, that is the new baseline in comparison to the blue line, which was the first projections that we had. We reforecast in March and we've reforecast again. And turning then to the next page, page 57, you can see the table there presents the additional cash flow funding we're having to allocate from reserves in order to support that later delivery of the 2 programmes, and it's to the order of 40 million. But colleagues, rest assured the 40 million is already contained within the 120 million that I spoke to you about just now. If I then take you to page 60, despite the significant financial challenges we're currently facing, we do have 2 areas whereby we're recommending that we must make prioritised investments because of health and safety concerns. One is in our in-house residential care and nursing homes, and the other is regarding ash dieback. And the recommendation is to use 3.8 million of gain from Treasury management savings in order to prioritise towards these critical health and safety items. There are then quite a number of areas identified falling into 2 categories. One, unavoidable investment pressures, and the other, investment priorities. These are areas that we're not in a position to make recommendations about at present because of the financial challenges, but we will need to give further consideration to when we are discussing the budget in February. And obviously the spending review, and we're expecting to hear something today on the comprehensive spending review, albeit we don't expect to get the actual detail until late in December. But that may help us to understand recommendations that we can bring forward on those 2 areas. If you turn now to page 70, it talks about the budget process moving forward. As you know, we've got a very well established, tried, tested and successful approach to our savings programmes, and that has served us extremely well since 2010. I did say in a previous report that we would look at whether we had to embark upon the 2-year programme now, or whether we could perhaps stay a further year, depending on whether we received a multi-year settlement or not. As you know, unfortunately, it will not be a multi-year settlement, but a single-year settlement, and therefore we have no option but to continue with our next savings programme. You can see the target savings for each of the departments, and you can see the high-level timetable. I think one point to make really clear is that as part of our reprioritisation of reserves, we did maintain the 40 million cash flow funding in the budget bridging reserve in order to support our 2-year process. But what that means is we have absolutely nothing left in reserves to support any late running of savings delivery. Therefore, all proposals that come forward for this 2023 programme will need to be delivered by the 1st of April 2023 at the latest. Colleagues, that was all I really wanted to take you through. The report and the recommendations are on page 46 at paragraphs 5 to 16 A to D, but I'm happy to take any questions.
Councillor Reid, do you want to start the ball rolling?
Yeah, thank you, Leader. Clearly, and this is a difficult situation, and Councillor House effectively referred to it in the question he asked up front, and I'm sure we'll refer to it again in the County Council meeting. And in many ways, we don't know the answers yet. There are going to be announcements which are coming through. One of the things that also worries me that the Director didn't stress, but I am worried about, is the decline of the council tax base as a result of some businesses being forced out of business as a result of the COVID-inspired decline in the overall activity of the economy. I mean, there is very little that we can say at this stage to add to what the Director has put, other than I think it is right for you and me and every councillor to continue to lobby our MPs and the government to ensure that they fully understand the impact that this is having. We can map a way out of this, but actually what we really need is for the costs and the knock-on costs of COVID to be met by the government so that we can get our finances back on the straight and narrow.
Thank you, Councillor Reid. On that point, I am meeting up with virtually all our members of Parliament this week. What I've done is ensuring that I meet as many of them as possible. I'm having a number of different separate meetings with them and making these very points that Caroline Williamson has made about the importance of the funding from central government to at least cover the costs of COVID, and also recognise the increased burden of social services, both for the elderly and those with special educational needs. I notice Councillor Heron has got his hand up.
Chairman, thank you. And I just want to say a little bit about paragraph 90 on page 60 in the ash dieback, because it may seem strange to some people that in these incredibly difficult times that we're spending money on ash dieback. And I note that a further report will be coming, but I did just want to update members that ash dieback is a devastating disease in trees to our countryside and our landscape. We will undoubtedly see significant changes over the coming decade as to how our countryside, our roadsides and our rural areas look due to this disease. But I think the important point to mention here is how we need to get ahead on this. Ash dieback is a disease that progresses very rapidly within the trees, and most importantly, they become brittle very quickly. This means that they do pose a risk to our highways and our rights of way, so we have to carefully monitor and take action where those trees could pose a risk to public access. But also, because of the fact that they become brittle, they become more expensive to remove the longer you leave them. So this is something that we do need to take action on, and I welcome that even in this difficult time, we have the resources to protect the public on our highways and rights of way. Thank you.
Leader, I can add a little to that.
Yes.
Sorry to come in, but there's 130 trees which are going to be felled in the Havant area because they've got ash dieback, and the disease has spread to 20% of the crowns at the moment. And as Councillor Heron says, they will become brittle and form a risk to pedestrians and traffic. So it's a tragedy. I hate it, but we're having to take those 130 down. And that is an example of the expenditure that we're incurring as a result of this.
Thank you, Councillor Reid. Councillor Humby, Rob Humby.
Yes, thank you, Keith. Just wanted to make a few points about the actual paper, and in particular thank Carolyn and her team, because the ground beneath has been moving rapidly, and having to react to that literally on a daily basis, as I say, is a credit to her and her team. I mean, we've been going through the process of transformation for 10 years, and the efficiency that we've been making. Now, clearly, it's a challenge to all local authorities, but it was really just to put on record that absolutely support the paper, the process that we're going through, and it's because of the work that we've done over those last 10 years that we are in a position we are in, accepting that it is going to be challenged going forward. So I think, you know, certainly from ourselves, Leader, and the rest of the Cabinet, to thank Carolyn and her team in these very challenging times and the work that they have done.
Thank you, Councillor Humby. Are there any other comments at all? Okay, well, we'll move to the recommendations. Before I do so, I would just like to make a general comment, and that is that it's a particularly difficult time to make forecasts into the future, simply because of the nature of the present pandemic and the knock-on effect on public finances throughout the country. But what I think is important is that we do what we've done before and try to plan ahead as best we can to ensure that the economics or the finances in Hampshire remain on a strong, stable footing. Very difficult, but nonetheless, it's important that we look ahead beyond next year to see exactly where we are, which is something that we've done so effectively in the past. And largely because of that, we're in a better position than many other counties to deal with this particular crisis that we have at present. And on that rather somber note, can I ask you to agree the recommendations for the Cabinet in paras 5 to 15 and the recommendations for the County Council in paragraph 16, little a, b, c and d. Once again, if you're happy with the recommendations, you don't need to do anything. If you're not, put your hand up. Thank you all very much. Those recommendations are approved. Let us move on to the safeguarding report, agenda item 8. And I presume that Steve Crocker, the Director of Children's Services, will be introducing this item.
Good morning, Leader. Good morning, members. I'm just going to introduce this and then hand over to Stuart Ashley, our Assistant Director, in a moment. But this is a piece of business as usual. We receive an annual safeguarding report that comes to Cabinet, and because it's the job of protecting children goes on, whether we're in a pandemic or not. And this report outlines what we've been doing in the last year and also tangentially covers some of the COVID issues. The key thing to take away, of course, is that Hampshire remains a very high performing children's services department in terms of safeguarding, and we also remain a very low spending authority in this regard as well. So high performance, low spend, that's a pretty virtuous circle that we're currently in. But I'll hand over to Stuart Ashley, who's going to just highlight 4 or 5 key points from the report, and then we're happy to take any questions.
Thank you, Steve. Thank you, Chairman. Good morning, members. As Steve said, this report identifies key national developments, it summarises performance and activity levels, and details a number of key local developments, as well as looking at future priorities. And I'll just pull out a few key points. We turn firstly to the section on national developments. Clearly, the pandemic has had a major impact on the service. Paragraphs 14 to 17 of the report evidence how we have maintained a full service throughout both lockdowns 1 and 2. We've had a 3-phased approach, with each phase being based on having fewer staff, but I'm pleased to say we've remained in phase 1, which is a business as usual, but doing it differently approach. So we've had a mixture of face-to-face visits to children and families, some face-to-face meetings, and others being done virtually through the use of technology. I have to say the service has adapted very well to the new arrangements. If I move on then to the performance and activity section, as can be seen at paragraph 35, we've seen a 7% increase in contacts coming into children's services over the last year. If you compare that to 2015, that's a 61% increase in demand, so significant year-on-year rises. Yet despite that, turning to paragraph 36, assessment timeliness remains exceptionally strong. Our children and family social workers have undertaken almost 20,000 social work assessments during the year, 92% of those meeting our timeliness target, which I think is impressive. In terms of local developments, I would draw the Cabinet's attention to paragraphs 49 through to 54, where we detail the transformation work in respect of children's social care, something that Ofsted highlighted as a particular strength in our inspection last year. We've introduced a practice framework for our social workers, creatively used new technology, and trained our service to have a strengths-based approach to working with families. And we've seen tangible benefits for families of this new approach. And until the pandemic, we were able to keep more children safely at home where it was appropriate to do so, bucking the national trend in terms of rising numbers of children in care. As I said, that has changed since the beginning of the pandemic. In this section, I would also point out the regional sector-led improvement work that the service undertakes. We do that on behalf of the Department for Education, and the details of that are set out paragraphs 62 through to 66. I think this is particularly important work, assisting other local authorities to improve the way they safeguard children. And then finally, Chairman, at paragraph 67, we've set out the future challenges the service will face moving forward, much as has been discussed in previous items, and of particular note the increasing demands for children's social care services, and of course the costs associated with the placements for looked after children, which will continue to be a significant pressure for the County Council. Thank you, Chairman. That's a very brief overview of the annual safeguarding report.
Thank you, Stuart. Very informative. Certainly a really encouraging report in many ways, despite the pressures. Any questions for Stuart or Steve? Councillor Reid.
Yeah, I suspect this is an impossible question, but you'll understand where I'm coming from. In the past, the Victoria Climbié tragedy produced a temporary increase in the pressures on looking after children, but Baby P produced an almost permanent one. And I'm wondering whether you have any feel for whether we're going to have a structural increase, which we have to cope with forever as a result of COVID-19, or whether the pressures will ease once it is brought under control.
The thing that Stuart may want to come in, and I'll just lead us off. My sense is that the pressures at the front door will probably ease, but we have to remember that when we intervene in a family's life, particularly if we have to take a child in care, that is potentially a permanent arrangement. So if one takes a child into care at the age of 4, then there are another 14 years in which we're caring for that child. And that means that some of the decisions that we've had to make in the last 6 months will remain with us for a significant amount of time.
I would just add to that the wider context of we've seen sustained rises in demand for children's social care services really since 2010 with the economic downturn. We know that causes more stress and strain on families, and some of the biggest issues we deal with are around the dysfunctionality of adults, particularly when they're under stress and strain. So I suspect we'll see sustained demand, whether it will be quite the same exceptional level, I hope not.
Any other questions at all? Councillor Stallard.
Thank you, Leader. It isn't really a question, it's just a comment, really, because the detail of the report has been very capably explained by both Stuart and Steve. But I just wanted to draw members' attention to the fact that despite the pressures imposed by COVID on the safeguarding system, that we have worked, or the members have worked extremely hard, and they have managed to meet all their statutory deadlines. Now, that was no mean feat. We've certainly had members of staff, especially in the care homes for our children, being so dedicated that they've actually stayed in the care homes at the time when COVID was at its peak, and they've not gone home to their own families. Such is their dedication. So there's a lot of good news in this report, and I think it's very appropriate to point that out, especially as staff have been under such heavy pressure. Also, of course, we are continuing a lot of the work which we are doing with other local authorities, such as Buckinghamshire, such as West Sussex and others. So as Stuart likes to say, it's business as usual, but rather differently. We are approaching things in a different way, and I think we will also have learned a great deal from the work that how we've responded to the safeguarding work during this COVID crisis. But I just wanted to reiterate my thanks to all the members of staff who have gone well beyond that which we could have expected them to go.
Thank you very much, Patricia. Are there any other questions before we move to the recommendations? Before we do, I'd just like to add one comment which really links this particular item to the previous one, and that is that, as I understand it now, 1/3 of our care leavers are now unaccompanied child asylum seekers. And that manifests itself financially in terms of the fact that the total amount that we're now spending every year on unaccompanied asylum-seeking children, and more specifically when they actually leave childhood and become adults, amounts to over £3.5 million a year. And that clearly will rise every year, and that's the net figure over and above the funding we get from central government, which clearly is inadequate to actually fully cover the costs of this particular item. Right, should we move to the recommendations? The recommendations are at at paragraph 5, 6 and 7 in your papers. Anyone got any objections to them? I can see no hands going up, and therefore I approve those recommendations. Moving on to item 9, adult safeguarding, and I presume that Graham Allen will be taking us through this particular report.
Thank you very much indeed, sir. So yes, I'm happy to introduce the report, and in line with comments made by Steve Crocker, this is an annual update as part of the usual business for Cabinet. So firstly, if I just make a few comments, and then I'll of course be more than happy to take any questions. The first thing I would like to draw your attention to is in paragraph 13 of the report, which makes reference to the recent appointment of an independent scrutineer, somebody called Jane Lawson. So Jane has been appointed to support the board and to provide critical challenge across the Hampshire Safeguarding Adults Board in terms of the partnership working and making sure that all agencies are both appropriately supported but also appropriately challenged in terms of their activity. Within paragraph 22 of the report is a link to the Hampshire Safeguarding Adults Board annual report. This report, and indeed a version of the report before Cabinet this morning, was taken to the Health and Social Care Select Committee in October as part of the pre-scrutiny process. Within paragraphs 39 to 46 of the report is an overview of performance both in the last financial year, which is the most relevant part of the report, but it also, again in line with comments made by Steve Crocker with regard to the children's safeguarding report, also makes reference to some of the additional activity that we've seen in this current year as a result of the pandemic. And just under paragraph 46 in the report is a table which shows the increased number of initial concerns brought to our multi-agency safeguarding hub in the period post-pandemic, so from April onwards. Positively, we've started to see those numbers reducing, but again, in common with colleagues in Children's Services, we did see an upsurge, certainly through the first part of this year in terms of additional referrals and additional activity. I'll pause there, but more than happy to take any questions. Thank you.
Thank you. Councillor Fairhurst, do you want to make any comments on the report?
No, I think it's an excellent report and very positive. I would like to thank Graham for taking up the chairmanship of the board and draw members' attention to the fact that Hampshire is now leading the development of policy across the 4 local authority areas, Portsmouth, Southampton and the Isle of Wight, as well as ourselves. And I think that, again, I think it's really good to see that we're all singing from the same hymn sheet at last. So thank you.
Thank you, Councillor Fairhurst. Any questions from my Cabinet colleagues? Are you all happy with the recommendations then? Please say now that you're not, otherwise I'll take your silence as indicating you approve the recommendations, which are at para 2, 3, 4, 5 and 6 of the report. And those are approved. Moving on. Item 10, Hampshire Community Safety. And who's taking us through that one?
It's
Rob.
Graham Allen again.
Oh, it's Graham.
Councillor
Sorry,
Mance.
Graham. Of course it is. Yes. Yes.
Thank you very much indeed.
You've got the remainder of the cabinet session, I think. Yes. Over to you.
Thank you very much. So, thank you very much indeed, Councillor Mans. So, Cabinet, this is an annual report. It's part of the assurance process for Cabinet and for the wider County Council. So I'm bringing this report forward on behalf of Hampshire County Council rather than simply from an adults health and care perspective. This is a duty that falls to Hampshire County Council under the Crime and Disorder Act 1998 and requires us to ensure that across our communities we are cited along with our partners, and our partners here include the District and Borough Councils, Hampshire Constabulary, the Office of the Police and Crime Commissioner, the NHS, the voluntary community sector, and indeed other partners, to make sure that we're cited on risks that affect our communities and that actions are underway to mitigate them. The purpose of the Community Safety Strategy Group is not to undertake the work, but to provide a level of oversight and therefore assurance in terms of the work that's being undertaken. Members, I would draw your attention to paragraphs 8 to 42, which identifies the key priority areas which have been identified through the work underway across the partnership, and also the actions that are taking place. Beyond that, the strategy and indeed the risk profile will be further refreshed by March of next year in light of work currently being taken forward by Hampshire Constabulary as part of their force assessment. It will be further informed by the Joint Strategic Needs Assessment and also the serious violence profile. I'll stop there, but again, more than happy to take any questions. Thank you.
Thank you, Graham. Councillor Joy, do you wish to add anything to the report?
Not so much adding something to the report, but actually simply just drawing members' attention to the fact that there's a whole range of priorities. There are 7 priorities in all set out in the report, which are extremely comprehensive. But it's fair to say that there is an extraordinary range of activity covered by this. And I pay tribute especially to Graham for the ability of actually drawing such a wide range of community organisations together. Now that's a real challenge, and this this report I think is certainly what we would want to see, because there is encouragement right the way through it. It just shows that we're in touch and that the organisations are working very closely together in partnership. Thank you, Chairman.
Thank you, Andrew. Any questions? Sean, Councillor Woodward.
Thank you, Leader. Yeah, really around the youth crime element, which I think, I fear, has become a real issue during the COVID pandemic. It wasn't before. There's an awful lot written here. There's a lot within each priority. What our residents that we represent look for is reassurance. And I think it would be helpful if some document of some reassurance documentation could be produced, which we could give some publicity to reassure people as to what is actually going on, to try and get these youngsters out of a life of crime, which is likely to be a full life of crime if we can't get any successful interventions, and dealing with the community safety aspects of people that are actually afraid to go out in the dark evenings, afraid in the town I live in to put up their Christmas decorations because they're being cut up and vandalised, afraid to go for a walk along a greenway because they're likely to get pounced on, and that's in Whiteley. That's not in the depths of of some areas that you might expect that sort of crime to be rampant in, and it really is. And I just think we have a reassurance role, and it would be really helpful if we could have a little bit of support in being able to do that in our divisions. And I think putting some of this into plain English, what it is, how we see the problem, what it is that we're trying to do about it, and how the various agencies work together would be really helpful. So this is a good academic paper, and it's an interesting read, but I just think we need to get something in plain English which can start reassuring some of our residents.
Councillor Joy, do you want to make a comment?
Yes, I want to come back on that. Chairman, I think Councillor Woodward makes an extremely important and valuable point. And I think this is something that we work on. And it's actually picked up also to some degree actually in the report which follows on Prevent. That is his observation is duly noted, and I think that's an action that we can take going forward.
Thank you, Councillor Joy. Any other comments at all? Okay, so do you approve the recommendation at Para 2? I see no dissent, so that recommendation is approved. And the final item on our Cabinet meeting this morning is the Prevent report. And again, I think, Graham, you're going to introduce that.
Thank you, Councillor Mann. So yes, the third of my papers and the final paper from me this morning. So thank you. Again, this is an annual update by way of insurance to Cabinet on work that is underway both by Hampshire County Council, but again, working with partners. And these are duties that fall to us under the Counter-Terrorism and Security Act 2015. So as I say, the paper is designed hopefully to provide assurance to Cabinet of work that was being undertaken across our communities. I would say that the particular detail in the report is brief, given the sensitive and confidential nature of work in this particular area. Members will understand the nature and the sensitivity of the work that is being undertaken, I'm sure. We have seen in fairly recent weeks the UK risk level increased to severe in terms of the threat of terrorist or extremist activity. That has been increased as a result of recent events both in France and Austria. Much positive work is being undertaken both through the Prevent Partnership Board, and this is a multi-agency arrangement which is led by Hampshire County Council, again working with key partners in the police, but also linking across into colleagues in educational establishments, both schools, colleges, but also universities, and a wider range of partners as well within district and borough councils. There is also an internal HCC Prevent delivery group, which has got membership across every department within Hampshire County Council to ensure that staff awareness and indeed appropriate activity is being taken across our services. And again, in terms of needing to be aware, it touches all areas of our activity, both from a social care perspective for adults and children, but also across into colleagues in environment, transport and economy, and indeed in CCBS, in terms of the use of our premises by community groups and so on and so forth. Again, we've got links out into the wider community, to the faith community and to others. I'll pause there, but again, happy to take any questions. Thank you.
Thank you, Graham. Andrew, do you want to?
Yes, just one comment. Thank you, Chairman. And that is, in particular in this report, of course, it picks up on the anticipated impact of COVID. Bearing in mind that sort of Prevent, sorry, I've got an airplane going straight past me at the moment. You might hear it in the background. Sorry about that. The Prevent essentially is designed to, as far as possible, prevent people being drawn into terrorism. And COVID-19 is anticipated to actually have an effect on the activity of extremists. Some examples are quoted, but for example, deliberate infection by COVID-19 sufferers and so on. Strange as that may seem, I mean, this is a realistic impact. And also a resurgence in interest, which is commented on in Para 10 among terrorists for using NBC, chemical, biological, radiological, nuclear weapons. We'll leave that to your imagination. But the point is these impacts of events as they come along are things which need to be taken into account. So brief as the report is, it does highlight the activities which are constantly being undertaken in partnership with a great number of other agencies. And so I commend it to you.
Thank you, Andrew. Judith.
Yes, thank you, Leader. I really just wanted to comment on the stark contrast between the remarks we were making in item 6 about community spirit, if I can put it that way, a duty of care to one another, considering others, and then what we read in here from paragraph 7 onwards about extremists using apocalyptic, you know what I mean, narratives, and deliberately infecting people. And, you know, I just find it so shocking that there is this wickedness, for want of a better word, and that these people are among us in our society. I despair. Thank you.
I think that's a point well made, Judith. I think we just have to do all we can to ensure that they're marginalised and they're not encouraged to recruit, and that we actually promote exactly the sort of virtue and unselfishness that you've indicated that we've mentioned in an earlier part of the Cabinet reports. I see no more hands. So if you're happy with the recommendations of para 2 and 3, and I don't see any negative responses to that, so those recommendations are approved. And that brings our formal Cabinet meeting to an end. I'd like to ask members of the Cabinet to remain to hear an update from Steve Crocker and Brian Pope on schools, to be introduced by Ros Chad. But we'll take a quick comfort break for 5 minutes and come back just after 5 to 12 to hear that report. Okay.